Good evening and welcome to Medicine in Our Backyard. This is a series presented by the Newport Beach Public Library Foundation in partnership with UC Irvine Health. My name is Adrienne Windsor and I'm a board member of the foundation. We would like to thank our generous sponsors, Mike and Polly Smith. They have been with this program since its inception years ago at a luncheon with the late Dr. Steinert of the Herbert Gavin Eye Clinic. So we are just so appreciative of the support that they continue to give us. The program, let me do this as housekeeping. The Q&A session will come at the end. So we request that you hold all questions until the end of the lecture. Please use the Q&A box to ask questions instead of the chat box. Now, let me say just a little bit about our foundation. The Newport Beach Public Library Foundation provides things for the library that the city doesn't. I don't know if you've been to our media clinic, but if you haven't, it's an absolutely fantastic facility. We have donated computer stalls in the library. We have donated the seats in the friends room, the beepers when your computer is ready. And during the pandemic, we contributed significantly to the e-library. That was so important for all of us. We are a membership foundation. We have been back in person this year. This week marks the end of both the Library Live and the Witty Lecture Series. If you aren't a member, we urge you to become a member. And we are offering a special gift for you if you do become a member by May 31st. We are having a wonderful event to celebrate our new members who have joined between June of 2020 and May 31st of 2022. We are calling it a summer Stallsis celebration. It will be held on the bamboo court. There will be food and wine and a presentation by Connie Spinuzza, the award-winning author of the book, Chocolate Runs in My Veins. So if you join by May 31st, you will get an invitation to this great reception and party on June 25th. So go to our website, click the join button and become one of us. Now, I'm pleased to introduce our speaker tonight, Dr. Krishnansu Tewari. Dr. Tewari is a professor and chief of gynecologic oncology in the Department of Obstetrics and Gynecology at UCI School of Medicine. He is a member of the Chow Family Comprehensive Cancer Center and vice president of Orange County Obstetrics and Gynecological Society. Dr. Tewari earned his medical degree from the University of California, Irvine, where he completed his residency in OB/GYN. He went on to complete a fellowship in gynecologic oncology at UC Irvine. Our topic tonight focuses on women and breast cancer. Last month, we focused on colon cancer, which is the second largest cause of death after breast cancer for women. Tonight, we are focusing on the primary cause. We are very, very happy to have Dr. Tewari with us to tell us how we can take care of our bodies and the importance of using a designated cancer center here, especially at UCI. So please join me in welcoming Dr. Tewari.
Thank you so much, Adrienne. It's a thrill to be able to present for the Newport Beach Public Library. Me and my family, we live in Newport Beach, and I've gone to the library many times, and I think this is a really important topic, women surviving cancer, because that's really the goal. We don't not only want to cure cancer, but we want the patients that are cured to have a great quality of life. And I think that my entire career, professional career, has been at UC Irvine, where we have the only National Cancer Institute designated comprehensive cancer center in Orange County. And why wouldn't you get treated there? I'm here to show you why I think it's important to be treated at a comprehensive cancer center. And I'll give you the answer right now. It's because of resources. The Cancer Center has a lot of resources to support our clinical trials. most of our patients with cancers need not only surgery, but they need something else, like whether it's chemotherapy, radiation therapy, immunotherapy, targeted therapy, or combinations of these things. And the only way we've made advances to find out whether these medicines work is through clinical trials. And you can't get these clinical trials done, not the large clinical trials that inform our practice, without having access to them from a comprehensive cancer center. So what I'd like to do is share with you what we're doing in gynecologic oncology at UC Irvine. And most of the things I'm sharing with you are the result of clinical trial participation of our patients. Participation in clinical trials is always voluntary. Patients are not treated as guinea pigs. That's something that we always hear about when some people are skeptical about clinical trials. But actually, all of the advances in cancer, and I'm saying every single one of them, all of the advances in the management of cancer have been through clinical trials that have been carried out at comprehensive cancer centers like the one at UC Irvine. So, with that being said, I want to emphasize that in all aspects of life, knowledge is power. And the more you know about a cancer, the better you can outsmart it and defeat it. So we are going to populate this wheel. This is my Dr. Tewari's wheel of oncology. This is the kind of these are the kind of things I do at UC Irvine. And like I said, our Comprehensive Cancer Center allows this to happen. This is pretty exciting. Let's go. Let's start. The discipline. Gynecologic oncology is a very important discipline because to be a GYN oncologist, you have to learn how to take care of women that are pregnant. A very important time in a patient's life is when they're giving birth, and we all train in obstetrics, and then we go on to train further in managing cancer. So you can almost envision that we're at both spectrums, both ends of the spectrum, at birth and when patients are facing life-threatening illnesses. Gynecologic oncologists, like myself and my colleagues, are the only cancer specialists that not only do surgery, but we also give the chemotherapy and enroll patients on clinical trials. If you have colon cancer or prostate cancer or lymphoma, you have to see maybe a surgeon, and then you have to go see a medical oncologist to get chemo, or a radiation doctor. GYN oncologists do everything, and that specialty was created by Phil Desai. Phil Desai is seen here. He was born in '46. He unfortunately passed away 4 years ago. He was a professor at UCI and spent his entire career at UC Irvine from '76 to 2018. And he really created our field of gynecologic oncology, where we're not just surgeons, we're not just doctors that do chemotherapy, but we're also designing and running clinical trials to help patients live longer and help patients live better. So the discipline of GYN oncology was started by Phil Desai here at UC Irvine. Let's look at the next part of the wheel, surgical innovation. Some of the most exciting things that we have today in terms of surgery are, again, have occurred through clinical trials. For example, robotic surgery for cancer of the womb. What used to require patients to be cut open and stay in the hospital for 4 or 5 days, now the patients can go home the same day and recover within a few days. Robotic surgery has been a game changer. We have a fleet of the most sophisticated robots at UC Irvine, thanks to our cancer center. Sentinel lymphatic mapping, rather than taking all of the lymph nodes out and leaving patients with swollen arms or swollen legs, through clinical trials, we've shown the safety and efficacy, or the success, of just identifying that sentinel lymph node, that first lymph node that the cancer is going to go to. Once we find that, if we know that lymph node is clean, we know the rest of the lymph nodes are clean, and we don't have to take all the lymph nodes out. Wow. That really helps patients who end up being cured, not suffering from swollen arms and swollen legs. Heated intraperitoneal chemotherapy, or what we call HIPEC for ovarian cancer. UC Irvine was one of the first centers to do a clinical trial in this for this type of, let me just get back here for a second, a clinical trial where we give heated chemotherapy directly in the abdomen after we cut out all the cancer for ovarian cancer. And in important papers have shown that this method helps patients live longer. On the other side of the spectrum, we learned that patients that have very early cancers don't need to have all their reproductive organs removed. For example, cervical cancer, which normally requires what's called a radical hysterectomy, if it's a small enough cancer, you can get away with just removing the cervix in young women who want to still have children. These two patients have given me permission to share their stories. There's on the left, we have Captain Jeannine Campbell. She's a captain in the U.S. Air Force, and she's also an intensive care unit nurse. And I removed just the cervix of her cervix cancer in 2006, and there she is standing with her 15-year-old boy. So she was able to get pregnant later and then have a child. And then most recently, another success story. This is one of my patients who's also given me permission to share her story. She had the same type of operation. We preserved, saved her fertility. And again, she was able to get pregnant and have a baby. Again, without clinical trials, without access to clinical trials through our comprehensive cancer center, these types of procedures would not be possible. Let's now look at science. Science is so important, and we've learned how important science is, right, through the COVID-19 vaccine and how important science is. What is translational science? Translational science is basically getting a discovery in the lab on the laboratory bench that can go help a patient. So we call it translational because it goes from the laboratory bench to the patient's bedside. And translational science is very important. The Queen of Hearts Foundation is a nonprofit of 3 sisters that who lost their mother to ovarian cancer many, many years ago. She wasn't treated by us, but they were very passionate about ovarian cancer. And they created this foundation to raise money through philanthropy to fund laboratories to do translational science, to discover things that can be moved from the bedside, the laboratory bench, to the patient's bedside to help patients. And this was the ribbon cutting ceremony in 2008 or 2009 when the Queen of Hearts Laboratory that these 3 sisters gifted to us opened at UC Irvine.
Wow.
The Beau Biden cancer moonshot. Beau Biden is President Biden's son. He unfortunately died from a brain cancer. And so when he was vice president, Vice President Biden, or then Vice President Biden, instituted the cancer moonshot. Because we are at a comprehensive cancer center, we were one of 5 recipients of what's a multi-million-dollar grant from the National Institutes of Health to study exceptional responders to cancer therapy. And I hold this grant, which is, like I said, one of 5 cancer moonshot grants. Let's look at clinical trials, the platform itself. We have a robust portfolio of clinical trials at UC Irvine, and I can't imagine why anyone with cancer would want to be treated outside of a university hospital. Universities tend to attract physicians that are less interested in the business of medicine and are more interested in really helping patients and saving lives. And a lot of that has to do with our cancer center because it provides the resources and the infrastructure so we can run these clinical trials. For example, we discovered here at UC Irvine that a medicine that can prevent the cancer from forming blood vessels can cause the cancer to starve to death. I studied this in cervical cancer and published the paper of this clinical trial in the New England Journal of Medicine in 2014. And this was probably I mean, most people would agree that the New England Journal of Medicine is the top journal in medicine. This one clinical trial done at our cancer center and actually done all over the country at other comprehensive cancer centers led to US FDA approval, Food and Drug Administration approval of this medicine for cervical cancer in the United States and approval in at least 60 other countries. There's drugs called Parp inhibitors, which first were shown to be active in ovarian cancer through clinical trials done at UC Irvine. And now Parp inhibitors are being studied in prostate cancer, in pancreatic cancer, in brain tumors, and also have been approved in breast cancers. But the first approvals of these Parp inhibitors were in patients with ovarian cancer, and the clinical trials were done at comprehensive cancer centers like the one at UC Irvine. Immunotherapy, you've probably all seen advertisements even on television of a drug called Pembrolizumab. The trade name is Keytruda. We try not to use trade names in these types of lectures, but I think you may know that name. But the immune checkpoint inhibitors were studied in clinical trials. We're studying them now at UC Irvine. We've done that for a while. And it's a way of activating a patient's immune system to attack the cancer. For example, when any of us have a bacterial infection or a viral infection, our immune system attacks it because our immune system recognizes that that bacteria or that virus is foreign to us. Well, cancers are made of different mutations. Those are foreign to us, but for some reason our immune system isn't recognizing them as foreign. These new medicines called checkpoint inhibitors basically turn the lights on in our body so that our immune system can recognize the cancer as being the enemy. And this has resulted in approvals of immunotherapy in many diseases, not just gynecologic diseases. Just this year, I published another paper in the New England Journal of Medicine of a clinical trial I ran throughout the entire world, in many of the world's comprehensive cancer centers, including UC Irvine, which showed that immunotherapy can improve survival in cervical cancer, just like I'd shown that other medicine did the same thing. We've got other drugs called antibody drug conjugates, which are like Trojan horses. It's a antibody that attaches to a special protein only found in the cancer cell, and the cancer is tricked into swallowing that antibody, but attached to that antibody is a drug. So it's like a Trojan horse. It gets into the cell and it kills the cell. We have gene therapy for ovarian cancer that we're studying at UC Irvine at our cancer center. And this study is almost completed, and the preliminary results are very promising. We've also got very complex medicines that we're studying that prevent things escaping from the nucleus of a cell so that they can stay and fight the cancer that's is growing to kill the patient. So lots of great clinical trials, and this was just a sampling of them. What's next? Community prevention at the top right. The same women that have funded our laboratory, the Queen of Hearts Laboratory, have also established a clinic at our medical center in memory of their mother, Ann Doby. Remember, Ann Doby passed away from ovarian cancer, and we now have a clinic where we can screen women in the community who may have a high risk for developing ovarian cancer or breast cancer based on their family history. And so this is called Ann's Clinic, and we see patients every week in this clinic. We have an office not only at our medical center in Orange, but we also have one in our Laguna Hills office and in our Newport office. We also are very involved in pediatric HPV vaccination. Remember, HPV is what causes cervix cancer, and cervical cancer is the only cancer that exists for which there's a vaccine. Down here, let's look at our national voice. Our Society of Gynecologic Oncology, UC Irvine has, in our training program of gynecologic oncologists, we have the oldest training program in the country, and we have now made 4 presidents of the Society of Gynecologic Oncology. The most recent one is Dr. Yamada. She was president this year. And then in 3 years, Dr. Wendy Brewster, who also trained at UCI, is going to be a president. The other 2 presidents from UCI were Dr. Desai, who I mentioned earlier, and Dr. Berman. We have a direct corridor with the National Institutes of Health. As I said, I've got a grant from the Bo Biden Cancer Moonshot, but we have other grants from the NIH. Our clinical trials, many of them have been developed in conjunction with the National Cancer Institute. And as I said, many of the drugs studied at UC Irvine's Comprehensive Cancer Center have ultimately received approval by the U.S. Food and Drug Administration, and now have changed the practice of medicine and cancer throughout the country and sometimes throughout the world. What about global health? Every year, except for these last 2 years because of COVID, but for 7 years previous and now starting again, we take medical students with us to Tanzania. Tanzania is probably the country that has the lowest doctor to patient ratio, 1 doctor for every 50,000 patients. And cervical cancer is a terrible disease there. We take our students over there and we teach them how to screen for cervical cancer. And we train the nurses that are on the ground in Tanzania on how to do this, because this is probably the only time in these patients' lives where they will ever be screened for cervical cancer, because screening just doesn't exist in poor countries in Africa. This is some pictures from our screen and treat program. I just think this was from 2018 or 2019. I travel with them each year. And then finally, medical education is the last part of our wheel. You can see this was our most recent fellowship alumni gathering at the Society of Gynecologic Oncology on the right side. We've trained 58 fellows. Of those 58 fellows, 2 have passed away. Of the 56 fellows that are alive, 53 of them are division directors like myself, or department chairmen, or cancer center directors throughout the country. And here on the left side, you can see my 4 doppelgangers from UCSF, UC San Diego, UCLA, and UC Davis. These are all division directors, and we're very interested in medical education. So there you have it. This is Dr. Tewari's wheel of oncology. And I have to say, none of this would be possible without having access to a comprehensive cancer center like the one we have at UCI. It's the only comprehensive cancer center in Orange County, and it does really great work. I've brought in, probably of the $592 million in research funding for the past fiscal year, I probably brought in about $4.5 million of that. And as of this year, I was ranked number 13 worldwide for expertise in gynecologic cancers out of over 130,000 oncologists.
Wow.
And I'm not here to brag. It's the reason I'm ranked this high, and the reason I'm able to bring in all this funding is because of the opportunities and access to different programs that our cancer center provides. It's basically made my career, and I'm very grateful to it, because it's allowed so many of my patients to live longer and live better. Even if you get on a placebo of a clinical trial, you still do better than patients that are not on clinical trials. And the reason for that is the clinical trials are audited. There's so much attention paid to the safety of things. And when a drug turns out to be active, patients that may have been on the placebo arm get access to that drug months before the FDA ultimately approves the drug. So I really think the take-home message from today, and I'm so grateful for the Newport Beach Library Foundation and the program to allow us to talk about this, is you really need to talk to your doctors about clinical trials and comprehensive cancer centers. And if that means your doctors have to refer you to us and maybe not be able to take care of you directly, we always work with the community oncologists to maintain that connection that you may have with your doctors. But if I was sick, or if any of my family members or friends were sick, the first place I'm going to is a comprehensive cancer center. I'd like to now leave you with a video. Kunga Wagmo Opshaw works also for the Newport Beach Foundation. She's head of the program. And we're going to share a video that was aired on Christmas Eve in 2020 of a patient that benefited from work we did studying chemotherapy during pregnancy. Another clinical trial that we were involved in. We were the first people to do this, and this patient benefited. Let's hear this video. Thank you.
Now at 4:30, meet a health crisis survivor. She's beating cancer, and now she's beating the odds over COVID-19. Bernadette Hernandez is a fighter as well as a new mother.
Yeah, while 2020 has been a challenge for most of us, it's been especially challenging for her. KCAL 9 Orange County reporter Michelle Geely spoke with her.
Hello.
Hey there.
Hello, hi.
Today is the first time UC Irvine oncologist Krishnansu Tewari had a chance to meet 9-month-old Ariana. The Yorba Linda girl will one day learn about all her mother went through during pregnancy. A cancer diagnosis, the necessity for chemo, surgery, and then chemo again. And to top it off, Bernadette Hernandez recently recovered from COVID. There is so much to celebrate after an extremely difficult year.
It's a real problem with cancer and pregnancy because there's so many issues. There's issues regarding the baby,
issues with the mother's health, the timing of delivery, the route of delivery. It was very difficult, and ovarian cancer itself is a big problem. It requires really very complicated chemotherapy and very complex surgery.
It's no wonder Ariana was given the middle name Angel. She's my angel, Bernadette told me. Chemotherapy is rare for pregnant women, yet the baby suffered no negative health effects. Normally, ovarian cancer surgery is done before chemo, but Dr. Tewari says had it been done first, the patient would have lost her child.
It's definitely been a challenging year. I've just stayed strong. There are times where, it gets very tough, and I have to just remind myself, don't give up, keep fighting, stay strong, get through this.
31-year-old Bernadette Hernandez, who is a fitness coach, stayed strong physically and mentally during her last rounds of chemo, training for a bodybuilding competition. 2 months ago today, she won 5 medals in the SoCal Classic. First place in women's athletic and scored in the top 3 in the bikini competition. And the best news of all is her cancer is in remission. In Yorba Linda, Michelle Geely, KCAL 9 News.
Thank you so much, Kunga, for sharing that with our guests today. And I'm happy to take any questions.
Thank you very much. That was really wonderful, wonderfully informative. Now I'm looking for the questions here. Oh, can you see my video now?
I can see you, yes.
Oh, okay. Okay, I had a message from Kunga to start my video. So I hope everybody else can too. And I'm trying to open the Q&A. Says no open questions, only hosts and panelists. Oh, here we go. Okay. All right. My mom has recent cervical cancer, and I have 2 questions regarding treatment side effects. Number 1, with immunotherapy, there is a slight chance for the immune system to attack the healthy cells of the body. How often do you see major complications from Keytruda in cervical cancer patients?
Yeah, let me take that question first. Yes, there is that possibility, but it's rare. Most patients may have some effects, or most patients are not going to have significant side effects. Maybe 5% of patients may develop a severe case of colitis, which is inflammation of the colon, or a severe case of pneumonitis, which is inflammation of the lungs. But for the most part, Pembrolizumab, or Keytruda, as you call it, is very well tolerated in women with cervical cancer, and it's been approved by the FDA. And I think it's really important that your mom gets this. It's important for the doctor to monitor her thyroid tests, because Keytruda the immunotherapy can affect the thyroid. And so I do have a patient that did develop low thyroid with Keytruda, but I've just given her thyroid supplementation, and she's doing fine. The second thing is a very important question regarding bevacizumab. Now, that's that drug I talked about that prevents blood vessel formation to starve the cancer so it can't feed itself. And it's absolutely true that patients who've had prior radiation therapy do have a risk of developing bowel perforation, or what we call a fistula, which is a hole between the bowel and maybe the vagina, or the bowel and the bladder, or the vagina and the bladder. It is true. The risk is only about 6%. And so if your mom does not have any current side effects of radiation in terms of the colitis, if the colitis has gone away, bevacizumab does improve survival, and I would recommend that she gets that. I have no stock in bevacizumab. I have no stock in Keytruda. My only bias is that I know these medicines work, so that's why I want patients to get them. Here's one from Michelle Lewis. At what age should daughters of mothers with a breast cancer history, BRCA negative, begin getting annual mammograms? Yeah, so it's important to understand women with breast cancer may have a BRCA mutation. And when I see BRCA negative, it's important to understand that the BRCA testing has really come a long way over the years. And so if the BRCA testing was done more than 5 years ago, I would recommend that the mothers get retested. Certainly, if the mother is BRCA negative, and the father's BRCA negative, the daughter's risk is very low, and she can get annual mammograms at the whatever the appropriate time that the American Cancer Society suggests, which I believe is 50 these days. But if they're BRCA positive, we need to start thinking not just about breast cancer surveillance, but also ovarian cancer surveillance, and that should start early with a plan to consider finishing having your families by age 35 so that at least we can think about getting the ovaries out. So long-winded response to Michelle's question, but the key is if the mom who's BRCA negative was tested more than 5 years ago, I think it's important to get retested.
All right, and we have a question here about the causes of cervical cancer. What can we do to keep it at bay?
Yeah, the best thing, so cervical cancer is a incredibly interesting cancer because it's one of the few cancers that we know exactly what causes it, and that's HPV infection, which is a virus that's sexually transmitted, and we can prevent it. We can prevent it with screening, getting your pap smears regularly, or getting an HPV DNA test regularly. But most importantly, our young kids, beginning at ages 9, are eligible to get the vaccine. And the vaccine does not make kids more promiscuous or anything. It's just so important because this is a disease that kills young women. And so to keep it at bay, get vaccinated. And if you're not vaccinated, make sure you have healthcare coverage so that you can get pap smears and HPV DNA tests on a regular basis.
Is that common knowledge, the cervical cancer vaccine, or is that something that would be recommended by a physician to a mother? Or
Adrian, you bring up a really good point. It is common knowledge, but the problem is this: pediatricians are the vaccinators. Gynecologists, we don't vaccinate. The problem is pediatricians never see cervix cancer. Gynecologists who don't vaccinate see cervical cancer. So there's been this disconnect. So in the United States, the uptake of the cervical cancer vaccine has not been as robust as we like it to be. So one of our community outreach programs here at our cancer center is to get the pediatricians on board. You know, they're used to mumps, rubella vaccines, all these things. But now, hopefully, with all the interest and attention to COVID vaccination, hopefully we'll get some momentum going to get people vaccinated for cervical cancer. Cervical cancer is 100% preventable. And so it is heartbreaking that we have 13,000 new cases every year. And these are happening in women in their 30s, 40s, 50s when they're relatively young. They're in the middle of their careers. They got small children at home. No one in a developed country like the United States should get cervix cancer.
well, that's something we can all tell our daughters about now that we've heard you tonight.
Thank you. Yeah, thank you, Adrian.
Talk so much about the clinical trials. How would our listeners who wanted to participate be able to find out about these? Do they come to your center first and then you refer them?
No, what their doctor needs to do is if anyone's diagnosed with cancer, they should come to a comprehensive cancer center without second question or about thinking twice. That's what I'm trying to say. And the reason is, you know, my wife's in private practice at one of these community hospitals. That's great. I love private practice hospitals. They're great places to have a baby, great places to be treated for a broken arm, whatever. But when you're dealing with cancer, where just the slightest misstep could spell disaster for a patient, it's important to go to a comprehensive cancer center. So their primary care doctor, needs to refer them to UC Irvine's comprehensive cancer center. And if you go to the website, depending on what cancer the patient has, there's many experts that are just as accomplished as myself in many of these other, the other diseases, whether it's colon cancer or prostate cancer, and be seen by one of them. And we'll work together with the referring doctors so that the patients don't feel like they have to leave their, their doctors. We don't want to do that. We just want to get patients the best care possible. And if they're eligible for a clinical trial, we need to get them onto it. The problem is, because of the business of medicine, there may be some doctors, hopefully not in Orange County, but there may be some doctors that are eager to start treatment quickly to keep the patient in their practice. But when that's done, it disqualifies patients for enrollment on many clinical trials that could save their lives. And I hate to have to be so blunt, but it's a reality. I've not seen it happen in Orange County, but I've heard horror stories.
Well, that was one of the things I was going to ask you. What level of cooperation have you found with doctors who are regarding their medicine as business? Do you find they're hesitant to refer to the clinic, or?
Well, I work, I have a referral base that involves physicians at about 15 hospitals in Orange County, and I've found they're very happy to refer. They, I don't know, maybe it's the weather, but I think the doctors in Orange County, in the community, really have the patient's best interest at heart. And I think that's really nice. When I talk about horror stories, I get patients referred into me that were treated outside of Orange County, where they may not have been treated correctly, and it's very difficult to catch up and help those patients. But in Orange County, I think we're surrounded by great doctors.
That's good news. We have a question here about
Yep.
supplements, specifically antioxidants, used to be against doctors' rules while undergoing chemo. Now it's been found to be helpful for the chemo agents. What is your opinion and experience?
Yeah, Michelle, another great question from you. Yeah, supplements are great. If you're not getting actual chemotherapy, antioxidants should be fine. Now, there's so many new medicines now that are not chemotherapy. I tried to list some of them. We call them targeted therapy or biologic therapy or immunotherapy. Those medicines do not have problems with antioxidants. I still don't think we have a definitive answer as to the safety of antioxidants during actual chemo. So I would not use antioxidants during chemo, but many patients these days don't get chemo. They get these newer medicines, and the antioxidants should be fine. Supplements are always fine. Any type of holistic medicine or alternative health practice, I think it's great. I think it's great. Even at our Comprehensive Cancer Center, we don't have all the answers. So any help we can get to help our patients, I welcome it.
Oh, that's good news for those of us who take supplements. Here's a question. This will be the last question. This is about the HPV vaccine. Is it only for young ones, or should older people 50 plus get it also?
Yeah, so the FDA has approved it for young people and also has extended it to women up to about ages 44, 45. It's definitely going to work best in younger people because it's a preventative vaccine. It doesn't treat the infection. It prevents the infection from even coming. So the reason why it was approved in kids is the idea was to get it into kids before they started, having relationships, if you know what I mean. But there are clinical trials that show that it's effective even to women in their 40s, and it's been approved for women in their 40s. 50 plus, you'd have to pay for it, but I think it would work because, look, let's be honest. Many women are unfortunately going to have a divorce, and they're going to, after being married for a long time, for whatever reason, they may get divorced and they may start dating someone new. And maybe they were never exposed to HPV with their husband that they divorced from, and now they may get exposed with the new partner. So I'm all for it. We just don't have trials in women 50 or above, but I believe it would work.
All right, that's good advice. So have you found that the younger age of sexual activity has increased the incidence of the cervical cancer?
No, our numbers are flat. We have about 14,000 new cases a year. We're not getting more cases of it. The reality is, if young people are having sex earlier, that's not necessarily going to increase the likelihood of cervical cancer as long as they're getting vaccinated and getting screened. Most people in this country have access to healthcare. And most people who get the infection will clear it on their own. It's just there's a certain group of patients that are not able to clear the HPV infection, and those are the women that develop cervix cancer. But I do want to emphasize getting vaccinated has not been shown to increase promiscuity in young people. So it's really safe. Get your pediatrician to talk to you about it if you got young kids at home.
All right, good. Well, thank you so much, Dr. Tewari. It's been a very enlightening evening for us, and we are appreciative of you and of all the work that you are doing. It's just absolutely amazing to see what a broad scope of services you are able to provide there at the UCI Medical Center in this field. So it's inspiring. So keep up the good work, keep getting the grants, and keep spreading the word.
Thank you so much, Adrienne, and it was an honor to speak for your group.
Thank you. Now, this event is recorded. It will be available to watch on the Library Foundation's YouTube channel. And our next event, and it will be our last event for this year, is with Dr. Lisa Gibbs, who will be presenting about life after the pandemic, what we learned about mental and physical health. That will be on May 23rd. So go forward, have a great evening, and thank you all so much for being here.